If you are over 70 and dealing with an exhausting dry cough that hasn't responded to allergy pills, you're likely treating the wrong system. As we age, the nerve endings in the esophagus gradually deteriorate and lose their sensitivity. The body stops registering the classic burning sensation of heartburn, leaving the true digestive origin of the cough completely hidden from you. Without that pain warning, highly irritating stomach contents, including powerful digestive enzymes like pepsin, silently drift up the esophagus. They breach the upper throat and strike your sensitive vocal cords, forcing your airway to initiate a convulsive, defensive cough to protect your lungs. Because this is a structural failure of your digestive tract and not a respiratory infection, standard cough suppressants cannot resolve the issue. Stopping the micro-aspiration requires a mechanical solution. We are going to build a 4-step physical routine. These steps are engineered to keep stomach fluid down, strengthen your body's natural anti-reflux valves, and protect your airways without relying on daily medications. To start, you need 3 specific things: a 6 to 8 inch dense foam wedge pillow, comfortable clothing that allows your abdomen to expand deeply, and general medical clearance from your doctor to perform light neck exercises. By deploying gravity and muscle memory, you directly address the physical incompetence of the esophageal sphincter, allowing you to avoid the severe cascading side effects that come from long-term acid suppressant use. Step 1 focuses on nocturnal posture. Your first strict rule is to elevate the head of your bed using your 6 to 8 inch dense foam wedge pillow. You cannot substitute this by stacking standard pillows. Stacking pillows bends your neck forward and forces your spine into a curve, compressing your abdomen and actively increasing the internal pressure that forces acid upward. Your second requirement for sleep positioning is training yourself to lie strictly on your left side. Because the stomach connects asymmetrically, sleeping on your left side allows the pouch to hang downward, trapping the fluid below the valve. If you roll onto your right side, the fluid submerges the esophageal sphincter, allowing acidic liquid to seep into your throat. Correcting your sleep geometry provides a continuous physical shield against nocturnal micro-aspiration, allowing you to wake up without a damaged throat or an immediate coughing fit. Step 2 requires modifying your diet to reduce intragastric pressure. You need to switch from 3 large daily meals to 5 or 6 small meals to prevent your stomach from stretching and pushing upward. You must strictly adhere to the 3-hour cutoff rule. All food and fluid intake must completely cease 3 full hours before you lie down. When you eat, adopt a Mediterranean dietary pattern rich in complex carbohydrates and lean proteins. Keep your total saturated fat intake strictly below 7% of your daily calories. You must entirely eliminate specific chemical and mechanical triggers. Caffeine, alcohol, mint, and garlic chemically force the esophageal sphincter to relax. High-fat and fried foods severely delay gastric emptying, keeping your stomach pressurized for far longer. This dietary regimen is a targeted mechanical strategy to eliminate the internal pressure and chemical signals that force the esophageal valve open in the first place. Step 3 introduces active physical rehabilitation to rebuild your natural defenses, beginning with diaphragmatic breathing. Place your hands on your stomach. Take a deep inhale that pushes your belly outward into your hands. Ensure your shoulders remain completely motionless. The curl diaphragm acts as an external muscular wrap around the gastroesophageal junction. By purposefully flexing this muscle through deep breathing, you actively increase the resting pressure of the lower esophageal sphincter, rebuilding the anti-reflux barrier from the outside in. You will pair this with the active cycle of breathing technique. After you relaxed abdominal breathing, take a deep thoracic breath and execute a forceful huff outward. Reflux creates thick, pooling mucus in the throat that acts as a secondary mechanical trigger for coughing. This huffing action safely dislodges the mucus without relying on aggressive throat-clearing habits that traumatize your vocal cords. Executing these breathing techniques daily transitions you from waiting for pills to work to actively constructing your own anatomical defenses. Step 4 manages the hypersensitive cough reflex itself. We start with a cognitive intervention to use the exact moment a coughing fit begins, the effortful swallow. The next time you feel the localized tickle or urge to cough, substitute the reaction. push your tongue forcefully against the roof of your mouth and swallow as hard as possible, visualizing forcing down a golf ball. This intense swallowing action physically clears the pharynx and intercepts the neurological urge to cough. It breaks the destructive cycle where coughing spikes your abdominal pressure, driving more acid upward and causing even more coughing. To build permanent swallowing strength, you will perform the shaker exercise daily to strengthen the pharyngeal constrictors and prevent swallowed liquids from pooling in your throat. Lie flat. Keeping shoulders glued to the floor, lift only your head to view your toes. Hold for 60 seconds, then perform brief repetitions. Finally, if you are experiencing episodes of choking while eating or drinking, you must employ the superglottic swallow. Step 1. Take a deep breath. Step 2. Hold it tight to clamp your vocal cords shut. Step 3. Swallow your food or liquid. Step 4. Immediately execute a gentle cough to clear any residue before you exhale. This sequence acts as a critical failsafe. By forcefully closing your airway before the swallow, you ensure that stomach enzymes and oral bacteria cannot silently slip into your lungs and cause fatal aspiration pneumonia. With these 4 steps, you now have a comprehensive 24-hour mechanical defense system. Left side bed elevation utilizes gravity to drain fluid. Strict dietary timing eliminates upward intragastric pressure, and active physical rehabilitation reinforces the muscular barriers blocking your airway. Because muscular tension and neurological desensitization require time to develop, this routine requires strict daily adherence. Perform your shaker exercises and diaphragmatic breathing right on the edge of your bed each morning to set your daily baseline. By stepping away from systemic chemical suppressants and mastering your body's mechanics, you can permanently shut down silent reflux, end your chronic coughing, and breathe freely again.